We're talking about compliance. Can you touch on a little bit about appliance use?
Okay.
That was a mouthful.
Okay. Well, appliances are probably the most misunderstood and most argued component of temporomandibular joint therapy, because dentists and schools have named appliances from different types: the Dawson B splint, for instance, the NTI splint, the Michigan splint, just to name a few. Bottom line is that a Tanner splint is another one. The bottom line is these are named after somebody or someplace that has developed a system and has been able to market that in one way or another. Bottom line is dentists sell widgets. And so a splint, many dentists just sell a splint. Okay, but it's not so much the piece of plastic. And this is what is misunderstood. It doesn't matter what type of splint you're using. It depends on what you're using it for. For example, if I have a patient that has an acute painful temporomandibular joint condition, or that's maybe acute arthritis, or they have a disc displacement with reduction that's painful, and I put that patient into an appliance that only hits on their front teeth, I could actually make that patient much worse very quickly and make them into a situation where the disc is displaced, for instance, and doesn't recapture at all. So understanding what type of splint you're using is very important. And again, it comes back to the diagnosis. So what types of splints do I use? I would say my go-to splint, and what is most supported in the literature that I've read and been tested on, is a flat plane universal appliance. In other words, it's a flat plane, very little guidance, no steep ramps, that just allows that patient to go wherever they want to go. And it doesn't matter whether it's upper arch or lower arch. And then stable contacts on the back teeth. That's what I find allows the body to adapt, allows the injury to heal, and stabilizes the situation. We modify that based on the patient's needs, of course.